So good morning, everyone. Thank you, APAO, for this opportunity. So the title of our study was Characterization of Peters Anomaly with Glaucoma, Clinical and UBM Perspectives. The slides are not moving. Coming to the background, we all know that Peters anomaly is characterized by a shallow anterior chamber, synechia between iris and cornea, a central corneal opacity, and defect in the descemet membrane. It has been classically subdivided into type 1, type 2, and Peters plus, and these are the known genes as of now. UBM is a high frequency ultrasound which visualizes anterior segment in these opaque corneas. A definitive diagnosis of the posterior descemet defect is possible only by UBM, and studies have found high degree of consistency between UBM images and histological diagnosis in congenital corneal opacities. So our research question was, what is the clinical profile of Peters anomaly, and is there a prognostic value of UBM characteristics at presentation? The aims were to describe the clinical profile of patients with Peters anomaly presenting over a 5-year period, to characterize and classify the various UBM findings, to correlate the surgical outcome of patients with 1-year follow-up with UBM findings at baseline, and to study the genetic profile in those undergoing genetic testing. Ours was a retrospective cohort study over a 5-year period. We included children who had congenital corneal opacity with a clear area in the center and presence of a descemet defect on UBM, which was done using an open shell technique under general anesthesia. The following data was collected, and the glaucoma outcome at 1 year was graded as good, fair, and poor, depending on the glaucoma control. Coming to the outcome measures, we studied the demography and clinical features of Peters anomaly, UBM patterns of Peters anomaly, and correlation of clinical and UBM pattern at baseline to the surgical outcome at 1 year. Coming to the results, so over a period of 5 years, we had 32 eyes of 21 children of Peters anomaly with glaucoma, with mean age of presentation being 1.31 months and the mean follow-up duration being 33 months. Overall, 10 patients had unilateral disease and 11 had bilateral disease. The male to female ratio was almost equal. So over a period of 5 years in Peters anomaly, we noticed 4 distinct UBM patterns. So type A was only a descemet defect, where there was a descemet defect present only. Type B UBM was a descemet with a posterior stromal defect. Type C UBM was a descemet stromal defect with iridocorneal adhesions, and type D UBM was descemet stromal defect with corneolenticular adhesions. So these were the 4 types of UBM we saw in Peters anomaly over a period of 5 years, and we classified them into 4 types. Overall, type A was most common, constituting 47%, followed by type B 34%, then type C, and we only had 1 eye of corneolenticular adhesions. Coming to the follow-up results, after 1 year after surgery, the cornea clarity, intraocular pressure, and number of anti-glaucoma medications decreased at 1 year, while the corneal thickness on UBM decreased significantly at 1 year with significant p-value. We also did optical iridectomy in 15 of these eyes for visual rehabilitation, and the eyes with optical iridectomy had a better visual acuity than eyes without OI, although the p-value was not significant. And glaucoma outcome at 1 year was graded as good, fair, and poor, with 25% eyes of having good outcome, 47% having fair, and 28% having poor outcome. Coming to the correlation results, when we correlated the type of UBM with the glaucoma outcome at 1 year, we can see that the type A UBM had the best outcomes, with 13 out of 15 eyes having good or either fair outcome, while type C had similar outcomes. And type B surprisingly had worse outcomes, with almost 50% of the eyes having poor outcome. We also did genetic evaluation in 16 of these patients and found 9 pathogenic variants, with CYP1B1 gene being the most common in North Indian cohort. So to summarize our study was one of a kind study characterizing Peters anomaly with glaucoma. We classified UBM into 4 different types, with type A having the best outcomes and type B having the worst outcomes. Overall, 72% of the eyes had good to fair outcomes, with significant decline in corneal thickness after surgery. Peripheral optical iridectomy offers some visual rehabilitation in these children, and CYP1B1 mutations dominate in the North Indian cohort. So to conclude, this study provides novel insights into the UBM characteristics of Peters anomaly and helps in better prognostication of affected patients through UBM classification. Thank you.
Very nice and interesting study.
Thank you,
Just a
ma'am.
question, what was the surgery that you are referring to here?
Yes, ma'am. Most of the children underwent a combined trab with trab as the cornea is
Okay,
hazy in these children.
fine.
But we were able to manage mixed surgery in 2 of these eyes where the cornea was relatively clear in the periphery and we could visualize angles. But most patients underwent the combined trab with trab.
Thank you.